Good evening, everyone, and good morning, everyone. Welcome back to another episode of Dhammapariyesanā. And we've been not doing a series of kind of interviews last couple of weeks because things have been a little bit hectic. But today we're gonna be doing episode number 37. It's like day 37. It's a great pleasure for me to introduce our speaker today, who is going to talk to us about why physiotherapy is more than just pain management. Speaker today is Stephenie. Stephenie founded Namaste Physiotherapy Centre in Melaka, Malaysia in 2016. She's a certified Kinesio Taping Practitioner, CKTP, from Kinesio Taping Association International, which she earned from the US. And she also has another credential that goes by CSMT, Certified Spinal Manual Therapist, which is from Manual Concept Australia, based in Perth. And she has more than 9 years of clinical experience in treating various musculoskeletal pain. And her center, Physiotherapy Centre, goes by Namaste Physiotherapy Centre, www.namastephysiotherapy.com. Dhamma folks, please join me in welcoming home Stephenie Yap. Stephenie, how are you doing?
Hi, yeah, I'm good. Thank you for inviting me.
Thank you for accepting. Okay, so because our topic today is about physiotherapy, and a lot of people know physiotherapy is a subject that people think when they want some pain management therapies. But in our topic today, we're going to be discussing about physiotherapy can do more than pain management. So this is, a little bit, exciting to know.
Yes.
So because physiotherapy is always, revolutionizing about pain and how someone can, get better treatments from a physiotherapist. I want to talk about pain in the first place. Now, we know pain is something that we always struggling, especially if we have a sickness and something like that. So pain is affected by our situation and our fears, beliefs, and emotions. So pain is real. So you can see if there's a pinch of nerve, something happens to us. If there's an injury, we can really feel pain.
Yes.
So, and also pain is kind of a notification that something is not, something is not working properly in our body, right? So, if we talk more about it, we know that there are instances we can practically understand we don't like pain. Now, for example, it is why we pull away from a hot surface before we get badly burned, right? Especially if you are in sunlight. It is also why we limp after we twist our ankle, right? So we want to avoid things that hurt us, of course, pain. So it's unpleasant, which is why we want to avoid it or get rid of it. At the same time, pain is very complex because pain depends not only on damage to body parts, but also on amount of danger our brain perceives. So it's kind of a multifaceted thing. That is why we want to know pain from a professional like you, because you are an expert about how to see pain from a scientific perspective. So what is pain to you? How do you view pain?
Yeah, so just like how you mentioned just now, pain is an unpleasant feeling that many people have experienced it before. So it comes in like different form. We can have like a throbbing kind of pain, aching pain, dull aching, like or stabbing, or even sharp pain. So this different kind of pain that we can like feel it. So this is actually one of the senses that our body will perceive. And also like what you mentioned just now, when we have like an ankle sprain, we'll be limping and everything. So pain actually also is a protective mechanism. So when we have some injuries happen in our body, our muscles will act up like a protective kind of a system to protect us, and also the muscle will contract everything. So it's actually help to like protect us and giving us information, and also to tell us that okay, we have to stop like doing some other kind of movement, or we have to stop moving around anymore. So pain is something like it's a information give to our body to know that okay, we maybe need to stop and not continue some on our activities.
Stephenie, pain is very subjective, right? So my pain might not be your pain,
different.
but on a larger, broader perspective, pain is something that we experience differently. At the same time, the nature of pain could be same. So now, when someone comes over to your clinic, to complain and then to seek any treatment for pain, how do you? I mean, this is kind of a practical question. I mean, kind of a procedural question too. How do you normally give an advice in the first place? So, this part of the body is aching. So how do you normally start the conversation with that person about this feeling of pain?
Yep. So in the first place, we need to
Yeah.
Okay.
Yeah, I think there was a small internet error, but
yeah. Okay, so when the patient comes to our center and they are having pain, so before we started our treatment, we first have to like assess about the pain first. So we have to find out okay, where is the site of the pain, and also when did the patient get the pain, and also how is the intensity? Is it like disturbing during the sleep, or is it not that much irritate or is it affecting the daily activities? Okay, so after we found out, we still have to check. We have to do some assessment to find out okay, whether is this come from a muscles injury, or is it the bone injuries, or any like involved in the nerve and others like maybe like a tendon or ligaments. So we have to find out, then only we can like give advice on how can the patient to manage it at home. Okay, so for most of the patient, we advise not to just like having a bed rest. Okay, we don't advise the patient to just lie down or just rest and wait for the pain to go off, because it really don't help a lot. Maybe you just make the pain worse by just lying down on the bed. Yeah.
Let's talk a little bit about treating pain at this point. Now, as a physiotherapist, you first do your own diagnosis with the patient, and then now we move on to the treating part. Now, people are very interested about this part. Now, as the title suggests, the physiotherapy is not just about pain management. It is more about pain management. This is something that we can actually dig into under treating pain. Now, when someone approaches your clinic, I mean, not even your clinic, normally this happens across the globe. So the physiotherapists are not only looking at the pain that is manifest, but also they are really, I think, capable of looking at the source of the pain. Now, this is very interesting. It can go
Yes.
into a psychological
Yes.
level of this particular pain. Now, I myself understand pain is
Yeah.
mostly psychological from a Buddhist point of view, because people have more pain, more physical pain about a particular thing. Than what you call. People have more mental pain than the physical pain, because they think that what is manifest is more than what is really inside. So, as a physiotherapist, I think you have more experience about how to look into the real source of pain. So that is one thing. On the other hand, we understand different types of pain. For example, I would say susceptible, inflammatory kind of pain that primarily come from tissue damage, and also
Yes.
neuropathic pain. Could be damage or irritation on nerve, and patients can feel kind of a shooting, burning pain, so kind of a needle kind of a pain. Also, central nervous system dysfunctions. This is mainly caused by disease or trauma, because people are different. We call it CNS dysfunction. So when you look at different types of pain at the same time,
Yes.
the straightforward approach of physiotherapy is about pain. What you can share with us about how to treat pain depending on the source, at the same time, different types of pain?
Okay. So for all the pain, like even it's acute or the chronic pain. So like for acute pain, if like it's just a non-susceptible, like it's just a tissue damage. First, like from a physiotherapy side, we will have like electro modalities, like such as ultrasound, and also some other electrotherapy modalities to use to reduce the inflammation and also improve the blood circulations. So the one will be used on like the acute stage and to reduce the pain and inflammation or sensation. And also we have to let the patient know that what the pain they are experiencing, and also is what they should know about their pain. So they have to understand the pain first before they can manage the pain.
What if they
So
don't understand? What if they don't understand their
yeah.
pain primarily come from a place that is more psychological? I mean, they might complain about physical pain, but how do you convince
All right.
the
So
patients?
actually, just now, like you mentioned in the beginning, all the pain is real. Okay, we don't say the pain is a fake, or maybe they are just even they have no pain. But for other people, they will think that okay, maybe the person is just like faking the pain, or it's just from the psychological problem side only, without the pain. But the pain, they can feel the pain. They really feel the pain. So they will just complain of the pain. The pain is there. Okay, like the pain is real, the pain is there. So what the main problem, like why they feel it when biologically or physically there's no any injuries or no any damage that we can see or we can detect, but they feel the pain. So this actually is the brain playing the main role, the main part in it. So the brain actually send the information and tell us that okay, you are in pain. All right. So it's like and also for the pain level should not use as a measurement for like a tissue damage or injuries. This means that okay, if you have like a big tissue damage or big wound, and it doesn't mean that your pain will be higher than a small wound or anything. So, for example, like do you have like a paper cut before? right? So the paper cut is small, so maybe sometimes you can't even see it in your fingers or anything, but the pain is a lot. It's quite a lot, the pain. So we don't use the pain to measure the tissue damage or anything. All right. So from the psychological point, a lot of people would think that, okay, if the wound or is the injuries are or the damage to the tissue is quite a lot, and we'll have a lot of the pain. So this is what we see, that what we know, what we understand. So before we start everything, we have to explain to the patient, okay, maybe this is not the tissue damage that caused you the pain. Maybe it's just our body, the system is a little bit hypersensitive. Okay, like a bit like easily triggered or easily feel that the pain is there. Okay.
Stephenie, that's an interesting point. Like
Yeah.
pain without kind of a technical point of thing inside the body.
Yeah.
So how can you delineate a little bit more about how can you observe psychological pain? Because before you going to treat a patient, you need to specifically locate whether this is more from kind of a psychological perspective or psychological aspect, or more from a physical aspect. So as we all know that there could be multiple things that you might be looking at when you want to decide. This is basically from psychological perspective. What are the psychological manifestations that you can decide this is not a technical kind of a thing, this is not a kind of an acute thing, but kind of a psychological thing, like belief, attitudes, memory. So how do you distinguish pain with belief, attitudes, and memories? How do you give an advice? How you treat them with the psychological parts? Now this is more about treating the body.
Yes. Okay. So if we check the patient and like we'll check by using our hand, we will palpate on the patients. Okay, if let's say we can't find anything, even after we do all the tests are negative, we can't find any results, and we can't find any things that supposed to cause the pain from the patient. So also we'll be asking patient some question, and from their question, from their answers, we can maybe find some clues that, okay, this pain is not from the tissue damage. Okay, this one is maybe just the brain acting up, or it's the body system a little bit hypersensitivity, because they have a patient which come to us and will complain maybe like different body parts that have all the pain, and also maybe they will feel the pain all the time, or even some is not like just a fixed timing, because like for some of the cases, like mostly in like the back pain, they will have the pain mostly in the evening, or some they have it in the morning, but you generally getting better in the afternoon. So we can actually differentiate, okay, maybe this one is this type of back pain, and then this one is another type of back pain. But for some of the patients, they don't have like a fixed timing. They were just like having pain all the time, or inconsistent kind of the pain. So we have to get the clue from their answer, what they tell us, and also and we have to let them to describe what is their pain feels like. Some they can't really describe the pain.
So
It's just pain.
So active listening to a patient is very important, right? So physiotherapists let patients explain what they
Yep.
think about the
Yes.
pain and what are the
Yes.
stories behind pain.
Yes.
Yeah, that's a good thing.
Yeah, that's a very important part in our treatment. We have to let the patient tell us what is their side of the story, or what is the story behind the pain, and their history, everything we have to know. Yeah.
Great. Let's take a look at another interesting section of this topic. Now, a lot of people think physiotherapist is kind of a one
Yeah.
kind of a professional, like one, I would say, one area. Uh,
Yes.
they only focus on one area, but I think there are different types of physiotherapists. So
Yeah.
they mainly train, with a kind of a university setup or kind of with an
Yes.
association. But in your case, you earned a BA degree in physiotherapy from Manipal University, Karnataka, India. At the same time,
Yeah.
you earned your professional associational, what do you call, certificates from US and Australia. So now, looking at different types of physiotherapists, I wanted to explain and kind of, I think probably you can explain more about these aspects of physiotherapists. There are physiotherapists who are mostly focused on or expert in musculoskeletal aspect,
Yeah.
muscle pain, joint pain,
Yes.
arthritis,
Yes.
and I would say there are other physiotherapists who are focused on brain injuries, Parkinson's, stroke, uh, and transverse myelitis, spinal cord injury. Also, there are
Yes.
physiotherapists who are mostly focused on cardiorespiratory uh,
Yeah.
section, which has
Yes.
post-heart surgery rehabilitation, chest physio, suction, breathing exercises.
Yeah.
Another type of physiotherapy is sports rehab. I would say sport rehabilitation kind of physiotherapy. They are mostly
Yes.
focused on sports-based injuries. And also, there are physiotherapists who are expert in women health, especially incontinence, pre and postnatal and post-surgery kind of stuff. So, and also, there are physiotherapists who are focused on geriatrics. Geriatrics are kind of a new term to many. Geriatrics means care and treatment of old people, especially
Yeah.
old people. They can fall because of their natures, because they are senile. So geriatrics based physiotherapy, they more focus on the falls of seniors. So looking at these different aspect types of physiotherapy. So one
Yeah.
more time, if I am to mention all these, uh, musculoskeletal,
Yes.
cardiorespiratory, sports rehab, women health, geriatrics. So how do you describe these different physiotherapies, and what is your expertise in one of these? Are you kind of someone who is having a combination of all these, or are you special? Are you falling into one of these physiotherapies subjects? How do you explain that?
Okay, so actually, just like medical doctors, physiotherapists also will specialize in the different areas, like for hospital setup, or even for the sports academy, or like a sports team, football team, and also like a private setup like us, in the community area. So different places working will be focusing on the different place, and also one more in the specialty of physiotherapies are the pediatrics that we're treating with children. And like for now, also during this pandemics, our colleagues like working in hospital are working a lot with COVID-19 patients, and they are like helping them for the breathing and also their lungs, all the exercises for lungs and also their endurance, everything in the hospital, in the ward itself. And for us, in our this community level, we will normally focusing on the musculoskeletal, like just any muscle pain or any joint pain, anything that related to muscles, joint, bones, and also anything involved in the movements. Then physiotherapists can treat it actually. Yeah.
Never heard about physiotherapy treatments for babies. I mean, I would say, yeah, pediatrics perspective. How do you think it can happen?
For pediatrics?
Yeah.
Actually, okay. So actually,
so what are the usual injuries, or what are the kind of things that kind of a very kind of a small? I think it's not a baby, right? Kind of age about
any children or even babies also. Yeah. So for some of the kids, they have like some birth injuries during birth or even after, or there's some brain injuries to the brain, or
children.
They have a disease, to the children, even during birth or after birth. So physiotherapists, in general, are helping people to improve their quality of life, and also we have to make sure that their functional like activities, movements, everything. So this is what we're focusing about. So it's just like okay, if any people are having pain, the pain will affect the movement. So what we do, if we have to get rid of the pain and get them back on their movement and their normal activities. And same as for like other specialty like a neurology, also the same. So we have to make sure that like okay, after stroke or after some spinal cord injury, so we have to make them to move again and also maximize their functionality. Yeah.
So
same as a tips. Yeah.
Yeah. So as you said, there are different types of physiotherapists: musculoskeletal and neurology, cardiorespiratory, sports rehab, women health, pediatrics, and geriatrics. So these are the kind of different physiotherapists that we can see. But who are you in these categories? Are you a combination?
I'm focusing on like musculoskeletal, which is also in the and also which include the sports rehab and also more on the neurological part.
Okay, so it means musculoskeletal physiotherapy. They mostly focus on muscle pain, joint pain, post-op arthritis. At the same time, neurological physiotherapists, they focus on brain injuries, Parkinson's, stroke, transfers, myelitis, spinal and cord injury. Okay, spinal cord injury. So let's talk a little bit about what are the treatments, physiotherapy treatments for pain management and above. Now, what are the usual regular physiotherapy treatments for patients who have pain at the same time above? I know that there are fundamental treatments like low impact aerobic training, strengthening exercises, pain relief exercises. Sometimes they may use, physiotherapists may use TENS and ultrasound. I hope that your clinic is equipped with all these. So can you, before we jump into what your clinic offers, right? Can you share with us what are the regular mainstream physiotherapy treatments for pain and above?
Okay, so for now, like generally, we started to use like exercise therapy more compared to just by using electrical modalities. because we want to encourage our patient to have an active rehabilitation. Means that they join us and by helping themselves also to reduce their pain, and not just like a passive rehabilitation, passive type. Means that just like, okay, come and then just lie down there and then we do all the thing and they just go back home. Okay, so what we encouraging now our patient is to join us, to help us also to have both sides of us to incorporate both my technique and the patient efforts together to reduce the pain. So for some patients, we also will still using the ultrasound and also some TANs and also some other electrical modalities to reduce the pain and inflammation. And also sometimes we'll be using ice for the acute kind of injuries. And after that, we'll slowly put in the exercise gradually by giving the basic or the little bit, the lower intensity exercise for the patient to let them know that, okay, by doing exercise, it won't cause them to have more pain. Okay, we will have to let them know that it's not, if you have a pain, we don't just ask you to just rest. So we want you to move. So you have to know that, okay, what intensity that a patient or he or she should do if he had this pain. Okay, if let's say after he do some of the exercise, okay, he feel pain doing that. Okay, so we might need to reduce the intensity, or we have to reduce the repetitions. So we have to guide our patient on that, and also they have to do the exercise at home. Okay, so the exercise actually is including strengthening of the muscles and also stretchings. Okay, so sometimes we also will be including like a manual therapy, which is like mobilization, soft tissue manipulation, and also we like the manipulation for the joint and also soft tissue to loosen up the muscles and also to help the patient reduce the pain. Yeah.
Okay, so looking at your clinic website, I can see that folks, you can see Namaste Physiotherapy.com. This is the website of Namaste Physiotherapy Centre, founded and conducted by Stephenie and her staff. Under services, I can see pain management, pre-surgery conditioning and post-surgery rehabilitation, stroke or neurological rehabilitation, sports rehab, prenatal yoga therapy, kinesio taping, dry needling, and you also, give some talks. I would say health talks regarding spinal health, and other conditions, especially in different setups, school and university, company setup. So on one hand, you are kind of someone who is actually raising awareness about these things. So I wanted to ask you, so a patient who has pain, especially that needs physiotherapy, can find all the modern latest treatments in your clinic. Is that right?
Yeah. We try to.
Do they need to have a doctor's referral to come to your place, or they can directly book?
Currently, no. You can, like anybody that having pain, they can straight away come to our clinics.
So how do they contact
therapy treatments?
How can they contact you?
They can contact me through the Facebook, our Facebook page.
Yeah, our Facebook page.
Yeah.
How does it go by?
Through the can search Namaste Physiotherapy Centre, and you can connect to us by Facebook page.
Okay.
Okay.
Before we conclude, I have a question that is really interesting
Yeah.
to many, because nobody wants to go for treatment, right? I mean, people might think it costs money, even though, I mean, they are uh, taken care by insurance. So,
Yeah.
what are your practical advices for all of us
Mm.
to maintain a body or take care of our body without pain? What are the healthy habits that everyone can practice not to cause injury, pain to our body? We know that we are actually vulnerable to pain, but there should be some healthy tips so that we can live pain free. So, what are your practical advices for those who don't have pain, kind of a visible manifesting pain? And what are your piece of advices for those who may have pain, but they have to manage their pain? So, these two aspects.
Okay. So the main point is we have to keep active. Okay, so we have to keep on moving because a lot of people are actually having like a sedentary lifestyle, which is just not moving a lot, just by working maybe for long hours, working like for maybe at least 8 hours of working by just sitting in front of their laptops, everything. So that is actually a very big reason that why many people are having like especially neck pain or back pain, right? That's the main reason of having the pain. So actually just keep active, keep moving is the best treatment and also the best prevention that you can have without without getting pain. So if let's say you already having like the back pain or neck pain, so it's better for you to find your physiotherapist to know that, okay, to find out whether are you having some muscle imbalance or are you have a bad posture. So your physiotherapist will check and let you know that, okay, which muscle that you have to correct and what exercise that is suitable to do. And also that's okay, if you are a sedentary lifestyle, you have a sedentary lifestyle, when you have to go to exercise, make sure you don't overwork yourself, don't exerting yourself too much. You have to start with low impact activities first before you go for those high impact activities. So to prevent any injuries. Yeah.
Very interesting, Stephanie. Now, I like those 2 points. So, uh,
Yeah.
as you said, that we all are in a kind of a sedentary life because we are seated most
Yes.
of the time, not moving a lot. At
Yeah.
the same
Yeah.
time, when we are seated for a long time, like having this sedentary life, we don't
Yes.
have proper posture. So
Yeah.
basically, it's about how we position us. At the same time,
Yes.
what postures we're gonna use while we are doing particular activity, because nowadays everything has turned on to online things. People are
Yeah.
seated more often. So what do you think, how can people manage this, because they're supposed to be in front of the computer? So how
Mm.
can they balance out the moving thing without being into a sedentary life? At the same time, how can they adjust their posture? So what are the practical things they can do? Kind of tips.
Oh, okay. So for most of the office workers, and I actually encourage all my patients, especially those office workers, to move for like in between every like 30 minutes. They have to move a little bit. And also some of the simple exercise they can do while they are seated in their office. Okay, we not really will ask you to have to do, okay, take out your 30 minutes time when you're working to do exercise. No, you just have to do like some simple exercise like a neck stretch for a few seconds to the other side, hands to the back, open up your chest to stretch your chest muscles, or stretch your arms out to the bend to the side. Just this simple exercise can actually help like to release some of the tension on the neck and also the upper back. So for some of the patient, maybe they are having like a back pain, so they can just stand up and just move around just by like marching on the spot, just move around. Also do some light stretches by rotating their bodies side to side, and it actually will helps a lot comparing to you're sitting for long hours. By just adding like a few minutes or few seconds of the exercise in every 30 minutes, it actually will helps a lot.
Stephenie, when you have a pet, especially dogs, they really like going out. If the owner doesn't take them outside for a walk, they are very unhappy. So it looks like that our bodies don't like sedentary life. That is why they give us pain. So
it's a sign for us to move.
Yeah, the bodies want us to keep moving. Go here and there at least, give them some time. So moving thing at the same time, adjusting to proper postures. So they are really equally important. And as you said, if you have a chronic problem, then you can focus on low impact exercises, right? As you said, low impact ones, which are not really strenuous and pretty hard, so on your body. Thank you, Stephenie. Is there anything else you want to add, which we may have missed out on?
Really no, but just that is an important part, that is you have to we have to know what is the pain. Okay, that's important, because maybe people will just think that they actually maybe just focus on the pain, because pain is actually just a sign, it's a symptoms for us, but they could be the cause or the root cause for the pain. So we shouldn't just focus on the pain only, on the surface only. We have to see what's under it, what is the real cause for our pain. And also to prevent especially the muscles pain, keep moving. Just keep active.
Mobility. So mobility is very important. Stephenie, the other thing is there are people who do not take care of their body adequately. They might think, okay, this is a small thing, but over time the pain is becoming more. So that means they should not, hide their pain. If they have a visible chronic acute pain, they should definitely go see a professional like you or a doctor and get a kind of a doctor's advice, so that they are pretty safe. On the other hand, what about the people who have pain, but there are no other ways? They probably have to be on painkillers, and they have to live with pain. How do you view this living with pain, right? Because it's like living with COVID-19. How to live with that, right? Because things are still moving up. So what is your piece of advice for those who have to live with pain? There's no, probably some of the treatments are not really helping to go away that particular issue. But there are some treatments like physiotherapy or these alternative medicinal treatments that can keep that person okay, but not helping that to go away 100%. So what is your piece of advice for someone who is struggling on a daily basis with pain? So, both physically and psychologically.
Okay, so for those people, some are maybe just having neck pain or shoulder pain. They will still, or even some of the neck pain or shoulder pain they having and cause them the headache or migraine, and they have to take the painkiller every day to stop the migraine and headache. If not, they can't really focus on their work. So because of the headache and the migraine actually is coming from the neck, and they didn't know it before that. So after you get some maybe advice from assessment from the doctors or from our physios, after we try and if we can treat the treat the neck pain and we remove this neck pain, and the headache and the migraine actually will be like disappear as well. So this is like what I say just now. We don't just focus on the pain. We have to find out the root cause of the pain. So for people, they are having like those chronic pain, or they are having pain for like maybe over 5 years or 10 years, everything. Okay, so for them, they maybe have tried a lot of treatment, or maybe they have taken a lot of all the painkillers, but it actually didn't help them. So the pain actually is like a kind of like the memories. Our brain will remember the pain, even though we don't have any like physically damaged tissues in our body or anything. The brain will actually remember that pain. So for that kind of patient, for that kind of people, we might need to we have to know more about them, what they think about their pain first. Okay, we have to understand what they think about their pain. How do they look at their pain? Are they okay with the pain, or are they already getting used to it, or they are still feel the pain undisturbing? And we have to know what is the pain for them first. Then only we can like find a solution for that through, like, even if not through physically, we have to find a way to help them through psychologically.
So having them understand their own pain and having them, perceive, what they really think about, at the same time
Yes.
bringing your medical perspective, physiotherapy
Yeah.
perspectives into him or her. So that will be how you're gonna treat and look at it.
Yes. Yeah. Because like I say, we have to let the patient understand the pain. But if we don't understand the patient first, we can't really know what they are experiencing or what they feel. So first, we have to know what they feel first. We have to know what they understand about their pain and how they feel about their pain. Then only we can find a way to help them.
Okay, thank you. Dhamma folks, today joined with me was Stephenie Yap. Actually, Stephenie Yap is the daughter of a famous yoga teacher whose name goes by Sunny Yap. And I wanted to thank your father as well, Sunny Yap. At the same time, you, because you both working on your own capacities, especially to promote what you call health. At the same time, raising awareness about musculoskeletal health. At the same time, raising awareness about spinal cord health, and all those really interesting, important health conversations. Because regardless of profession, other marginalized things, we all can get pain, right, at different times.
Yes.
So this topic is such an interesting topic. So it is not just a pain about somebody in a certain country. The pain is common to all of us, and pain is real, as we talked at the beginning. And I hope that the people who watch this could understand what is pain and how a physiotherapist treats a patient with pain, and what are the main different types of physiotherapists. Physiotherapists are not one kind; they are many kind, and you have to specifically look at what the particular physiotherapy offers. Now, in your case, you are kind of a combination of many. And then we also talked about the generic physiotherapy treatments available. And finally, we talked about what are the exact treatments your clinic offers. Namaste Physiotherapy Clinic offers in Melaka. And you are a leading physiotherapy clinic in Melaka. And I hope that people who having acute and some pain and other things related to what we've been talking would approach your clinic to get more advices, more treatment, and I hope that everything will go that way. Thank you, Stephenie.
Thank you so much.
Not a problem. And thank you, our viewers. And I wanted to share with you another small announcement. And we have another interview coming up, which goes by Coping with Grief and Loss. Our guest will be Aruni Marapana from Cincinnati, Ohio, United States today. That will be early morning to you. It's going to be afternoon time in Ottawa. Thank you, everyone. Thank you. Have a good night. Have a good day. Take care.
Thank you.
Namaste. That is your
Namaste.
name of the clinic.
Yeah.
Okay. Thank you, Stephenie.
Thank you.